When it comes to healthcare solutions, Congressional Republicans are acting like they're in a political version of a coma. Here's how they can come out of it. Hello, I'm Steve Forbes, and this is What's Ahead, where you get the insights you need to better navigate these turbulent times. Democrats are gleeful these days. After recent election cycles that have been dominated by inflation, the border, and cultural controversies, healthcare is once again a sizzling issue, and Democrats believe they have the GOP on the defensive. They're successfully portraying Republicans as enemies of Medicaid who want to slash or cut off benefits to the needy. The internet is full of ads with sob stories of people asking why your local GOP congressperson is eliminating insurance coverage for their kids who have serious medical issues. It's not true, of course. The changes passed last summer included work requirements for able-bodied adults with no dependents and more frequent eligibility checks. Contrary to those ads, no widows and orphans and sick kids are going to get tossed on the streets. But why let facts get in the way, especially given the tongue-tied GOP? What is Democrats really licking their chops now is whether or not Congress will extend what were supposed to be temporary increases in Obamacare subsidies during the pandemic. Some households with six-figure incomes were eligible. The Democrats see these bloated subsidies for a failed program as a way station to a government-controlled single-payer system. The results of that, of course, will be less care, longer waits for medical services, and a suffocation of life-saving, life-enhancing advancements in health care. Yet, some panic-stricken Republicans, acting like deer in the headlights, are ready to cave in and extend the subsidies. Here's what the GOP should do. For starters, they should call their approach the put patients in charge of health care money. Take health savings accounts, HSAs. Over 70 million people are covered by HSAs. They embody a basic truth. When people spend their own money, they demand and get better value. But today's HSAs are hemmed in by restrictions that undermine their potential. To fix this, HSAs should be available to everyone, whether or not they have a health insurance policy. In fact, individuals should be allowed to buy their own health insurance policy with HSA funds. Limits on what individuals or employers can contribute should be eliminated or substantially raised. Contributions would remain tax-exempt. Restrictions on how HSA dollars are used should be removed for services like telemedicine, mental health, and preventive and wellness programs. All those restrictions should go out the window. Republicans should advocate making catastrophic coverage the foundation again for health insurance. Health insurance was never initially meant to cover colds, routine ailments, and basic prescriptions. We need affordable catastrophic plans that truly cover big unexpected expenses. Such policies would be far cheaper than what policies are today. The average family plan these days costs $27,000. Most households would leap at the chance to get a true catastrophic plan for, say, $7,000 or $8,000 and pocket the remaining $20,000. To help put the consumer in control of healthcare spending, Republicans should loudly and wholeheartedly tout what they call individual coverage health reimbursement arrangements. They could change that name. Unlike current HSAs, here the employee selects and owns the insurance policy, which can be bought on the individual market. Employees and employers can make contributions pre-tax. This way, individuals can take their policies with them if they change jobs or become self-employed. Their policies are fully portable. They, not the employer, own them. Along these lines, the Federal Employees Health Benefits Program should be open to everyone. For decades, federal workers have enjoyed an abundance of choices, scores of choices from the private sector instead of the single choice of most private employers' plans. Insurers should be allowed to compete across state lines. Republicans should also mandate full price transparency from healthcare providers, where costs are all itemized with severe penalties for non-compliance. Healthcare invoices should no longer read like ancient cuneiform tablets. To strengthen the medical safety net, the GOP should create vouchers that would let low-income Americans buy the same private plans as anyone else. I'm Steve Forbes. Thanks for listening. Do send in your comments and suggestions. I look forward to being with you soon again.